Hello, my name is Nadine Siciliano. I'm the clinical educator for 5 West, 5 North, which is inpatient rehab, and also for outpatient cardiac rehab as well. What I wanted to discuss today is for the RMC charge nurse workshop is managing staff assignments and collaboration. So we'll move along with our slides here. Okay, so what are some charge nurse qualities? Communication, because communication skills are absolutely imperative as a charge nurse. It's imperative because it helps a unit run more efficiently, more effectively, and safely, as well as providing a higher level of care to our patients. Resourcefulness. You have to be able to improvise. You have to have improvisation skills, flexibility, so the ability to multitask by helping out where needed on a unit, and also decision-making skills. You have to be confident making sound decisions to keep the unit running smoothly. Okay, so communication. So we're looking at here is multidisciplinary communication. So it's showing you on here, the nurses to the PCTs, to the physicians, to the supervisors, and then other departments as well and other units. So, if there's any issues that arise, you might have to escalate it to the nursing supervisor at that point, especially if it's during the weekend. If it's during the week and you have your nurse manager present, or assistant nurse manager present, you can always escalate it to them as well. So that includes, like I was saying, PCTs, physicians, supervisors, other departments as well, like I see in inpatient rehabilitation is that unit in particular, orthopedics and some of the other units is that you may have to communicate as well, clearly with physical therapy, occupational therapy, speech. Some other, departments may include radiology, interventional radiology, the OR, PACU, etc. Okay, and then very important is to practice respect. So aim for RSV. So respect is being respectful is essential to receiving respect and a cooperation of those around you. If you don't display respect, you're not going to get respect back. Also showing willingness to be a team player. So you're assisting in a unit as you see the need arise. Showing also responsibility and accountability. So you're accountable for decisions and follow through on unit needs. Okay, so considerations for staffing. All right, so it's going to be, first off, we're looking at with the yellow stars, patient needs. So what are we looking at with patient needs? We're looking at acuity level, what treatments are they receiving? Like peritoneal dialysis, TPN, do they need pleural drainages, etc. Special considerations, do they need to get an NG tube inserted? Do they have a PEG tube, central line that they need a dressing change performed on? Straight cathing for urinary retention, say you're doing a voiding trial and the patient's retaining. So you have to do bladder scans and then you may end up having to do straight cathing. So also safety, is a patient under one-to-one observation for self-harm or the potential of harm to others, or they have a safety companion, AVICIS, etc. Age, one consideration for age is minors. They do need the parents present. So when we take into consideration age, it could be that, or say that you have a patient that is a geriatric patient and you have dementia. It could be helpful to have familiar faces around, like maybe have a family member visit, so that they can keep the patient feeling comfortable and calm. The organization, we'll move on. We're organization where care is delivered. So what capabilities do we have at this particular organization? And the capabilities that we do have, does it meet the needs of the patient? An example may be you have, a newborn patient that needs intensive NICU care, they might end up getting transported off, say, to Jersey Shore Medical Center. Also the acuity level, resources to meet the patient's needs, things along those lines. Team members on the unit. So RNs, PCTs, what's their professional experience? Do they just come off orientation? What's the patient acuity level? And what's the staff competency level? Those are all things you got to factor in when you're factoring in team members on a unit. Evaluation. So is the current staffing assignment working at this moment, or does it need to be adjusted somehow? Okay, so basic information and what to know. Okay, so we kind of already touched on this. Staff competency and standards of practice. So does the staff have the skills? Do they have the competency level and knowledge to care to patients within their assignment? Special considerations for new team members just coming off orientation that may lack that experience and maybe have never practiced some of these nursing skills before. So those are considerations when it comes to staff competencies, okay, at their competency level. The typical patient population on a unit. So we've had a lot of changes occurring on a continuous basis because of COVID. The populations that have been designated to certain units. It's also important to know just consistently what patient population is on a unit in case you get floated there. And what patient population is currently on a unit. The hospital processes and policies. So I always say, when in doubt, you always refer to hospital policy and procedures. It's very important. Or again, as I mentioned before, you can escalate it to supervisor if you can't locate the correct answer under policies and procedures. Okay. So staffing and unit acuity. Okay, so again, we're looking at types of staff on a unit. So what staff do you have on a unit? You have your nurses, you may have administrative assistants, PCTs, monitor techs, patient observers, surgical technicians, respiratory therapy. It could be physical therapy, occupational therapy. So, what type of staff do you have on your unit? Okay, nurse-patient ratios, that's based on unit census, acuity level, the competence level of the staff, and the projected needs in the unit. Okay, so is it unit census when you're looking at that? Is it unit full? Is there a full census in a unit? That's gonna, guide how much staff that you're gonna designate, on a unit, or if you need to call the supervisor to maybe have someone floated to the unit. Or even, ask, another staff member if they would be willing to come in to assist the unit because you're short. So patient acuity level. So when we talk about that, do we have patients, are they stable? Are they declining? What's the frequency of med administration, medication drips? And what procedures do they have to go for in diagnostics? And then the projected needs of the unit as well. So were there call outs, as I mentioned before? Are they short staffed? Is the unit covering one-to-ones? Or are they, safety sitters? That's all pulling away from the current staffing levels on the floor. Okay, so staff competency. So, sorry. Okay, staff competency. So I this is just a reiteration of what I explained before. So it's prior experience, understanding, of diseases, and then their personal strengths and weaknesses. So gauging staff competency. So, we talk about prior experience. Is it a new RN just off orientation, or is it a seasoned RN that you have on a unit? Understanding of disease process. So what's their experience caring for that particular patient population? Personal strengths and weaknesses, so level of competencies with skills. Do they provide a good or bad bedside report? What's their documentation like? Do they have good bedside manners? So there may be certain patients that need, additional emotional support, and that's like a consideration. Then when we're evaluating staff strengths and weaknesses. So patient flow. Okay, so when we're evaluating that, it's awareness of potential discharges and admissions. So you have to have like good communication with the admissions office to figure out, and also you want to get an idea, what's going on in the emergency department as well, or how many post-ops are coming to the unit. Knowledge of current patient condition. So, as we mentioned before, are they stable or unstable? Are there changes occurring in patient condition? So are they declining to the point that we're anticipating calling a rapid at any moment? Or are they, meeting the sepsis criteria where we're going to be calling a rapid? Things like that have to be factored in. Frequent communication. So it's essential. You have to do your rounding to find out the current status on a unit. It's essential. So taking assignment. Okay, what to consider. Okay. So we talked about patient acuity level, the staff skill mix, staff experience level, and then what other responsibilities are there? Okay, so on-call staff. This is very important. So you have to understand when to call. So when there are call outs, it's better to address it earlier instead of waiting to see if there will be an increase in the unit census, like post-operative patients arriving, the ED is full with patients waiting on beds. And that's why it's important to communicate out to those other, units to find out, what we're anticipating the census increasing to. Also the deadline to call. So don't wait to request other team members to come in or float staff, from the nursing supervisor, especially if you're anticipating that the unit is going to be short-staffed and you have a full census, new admissions are coming, they're going to be arriving. It's better to address it as soon as possible. So your staff is not left short. Okay. And remember, it's important to be flexible, be a team player. And as it says here, team together, everyone achieves more. Okay. So it's important if your staff is coming to you because they have concerns, that you end up sitting down and providing the time for them to express those concerns. Because it can be very valid concerns that you're not able to see yourself when you're rounding. And then they're coming up to, they maybe witnessed something, and it could be a patient safety concern. It could be, an altercation between staff members, anything along those lines, or a dissatisfied patient or patient's family member. So it's important you take the time to sit down with the staff. And if they're showing concern, that you're being an active listener. So, included in the steps, you talk about sitting down. So sit down, you want to have a relaxed body language because it really calms those around you versus defensive posturing. Okay, relaxed body language, as I said. And then you're going to have, direct eye contact with them. It shows that you're actively listening and you're engaged in what they're saying, and then stop all other tasks. You're making them a priority by doing that. You're not in the middle of shuffling paperwork, together, or stapling things, or running around and kind of half listening to them. You're stopping what you're doing and you're taking that time to make them a priority. And then, as I mentioned before about purposeful rounding. very important. So leadership rounding. So what you need to do is communicate frequently with the unit staff. So you want to find out, are things running smoothly? Have any issues arisen? And then patient rounding as well. So are the patient's needs being met? Is it satisfaction? Are they satisfied with their care? And then the status of the patient's condition. And the only way we can really, gauge that is by doing our rounding, our purposeful rounding. So next slide. Here, I'm going to play a video for you right now, okay? It's titled Empathy.
Our new EV rental fleet is the absolute goat. Nice. Speaking of goats, is that Tom Brady? Yeah. That's in the reach.
Hey, you there? Okay. Um, So anyway, just to summarize, I think, I think that video expresses it very well. One of the most important qualities for any healthcare practitioner to have is have empathy, because we're all have our own personal struggles that we're facing. And, I think it's incredibly important to always practice empathy and be kind in our everyday lives. But thank you very much for attending the charge nurse workshop, and I look forward to seeing you guys out in the unit. Thank you very much.